Welcome to the deep dive. Today we're getting into something quite specific but really fascinating, a condition called Dupuytren's contracture.
Right. It affects the hand. Can be quite debilitating, actually.
And we're looking at how treatment for it might be, well, revolutionized. Our source is a document outlining a new system. It's called DupuyFix.
Exactly. It's all about improving one particular treatment enzyme injections, making them much more precise.
And the brains behind this proposal are Samantha I Muhlrad, MS, MD from Stony Brook University, and Lev Neymotin, PhD from N5 Digital, Inc. Quite the credentials.
Indeed. So our goal here, for you listening, is to unpack this. I want to understand, what are the problems with the current way these injections are done? What can go wrong? And then how does this proposed DupuyFix system aim to, well, fix those problems?
Sounds like a plan. Let's dive in. So maybe start with the core problem DupuyFix is trying to solve. What's wrong with the current enzyme injections?
Okay, so the main treatment using enzymes involves injecting something called collagenase. The brand name is DupuyFix usually. It dissolves the tough cord, causing the finger contracture.
Right. Sounds straightforward enough. Inject, dissolve, manipulate.
It does, but the delivery.
Yeah.
That's the crux of the issue identified in our source. The manual injection method, the way it's done now.
What's the problem with it?
It's fundamentally imprecise. The source puts it really well. It calls it a mismatch between the pharmacologic precision of collagenase and the mechanical imprecision of its delivery.
Okay. So the drug is precise, but getting it exactly to the right spot isn't.
Precisely. The physician is relying almost entirely on, well, feeling the cord through the skin palpation and their own anatomical knowledge.
Yeah.
And tactile feedback from the needle.
I can see how that might be tricky. You're aiming for a relatively small target inside the hand.
Exactly. And things like, how thick the patient's palm is if they've had surgery before, body weight. It all makes it harder to feel that cord accurately and consistently.
So this imprecision, it leads to problems.
It does. The source is clear.
Yeah.
It leads to variable results. Sometimes it works great, sometimes not so much. And more importantly, it carries significant risks. Needle misplacement, enzyme leaking where it shouldn't.
Okay, let's get into those errors. The document talks about injection error dynamics, right?
Yes. It highlights that with manual injection, there's variability in needle placement both side to side, so laterally and in depth.
And one is worse than the other.
Well, they argue that errors in depth are more common and generally more problematic. They actually describe the typical error zone as a kind of vertically stretched ellipse.
An ellipse, meaning?
Meaning you're roughly twice as likely to be off-target vertically too deep or too shallow compared to being off-target laterally side to side. About a 2-to-1 ratio, they estimate.
Wow. Why is depth so much harder to judge?
Think about it. Once that needle tip goes under the skin, you lose direct sight of it. You're relying purely on feel. And judging that vertical distance down through different layers of tissue to hit a cord that might only be, say, 3 millimeters thick. It's just inherently harder than making small adjustments side to side once you think you're close. Plus, the feel, the tissue resistance isn't always a reliable guide.
Okay, so you can be too shallow or too deep. Undershooting versus overshooting?
Exactly. Undershooting means you might not get enough enzyme deep into the cord, especially near the skin. Overshooting. Well, that's risky because right underneath the cord are the flexor tendons. You definitely don't want the enzyme affecting those.
And lateral errors. Missing sideways.
Yeah, or worse, getting too close to the digital nerves or blood vessels that run alongside the cord. Very important structures you need to avoid.
So it sounds like depth errors are the most common way things go wrong with placement.
That's what the source indicates, yes. Most frequent errors are depth-related. Lateral errors happen too, and can be serious, but maybe less frequent than being slightly off on the depth.
And these errors, they aren't just theoretical. They lead to actual complications for patients. The source has a table, right?
It does, yeah. It summarizes the kinds of complications seen in real-world use of manual Cyflex injections, linking them back to these error types. It really clarifies the impact.
Let's walk through that. What's most common?
Okay, skin tearing comes up first. Estimated frequency is pretty high, 15 to 30%.
15 to 30, wow. And that's caused by?
Primarily depth error being too shallow. If the enzyme leaks up near the dermis, the skin gets weakened. Then, when the doctor manipulates the finger later to break the cord...
The skin tears under the tension.
Yeah, exactly. Usually mild to moderate, but still not ideal.
Okay, what else?
Bruising or hematoma, also quite common, 10 to 20%. Linked to both shallow depth errors and maybe hitting small vessels laterally.
Yeah.
Usually mild. resolves.
Makes sense.
Then there's pain or inflammation near the tendon sheath, estimated 5 to 10%. This one points directly to overshooting going too deep.
Ah, getting enzyme near the tendon.
Right. Can cause finger pain, stiffness, moderate severity usually. Swelling or edema is also around 5 to 10%. Linked to depth errors generally, shallow or deep. Often just a reaction.
Okay, those seem mostly related to depth. What about lateral errors?
Well, temporary numbness or tingling happens in about 1 to 3% of cases. That's usually a lateral error irritating a digital nerve.
Ouch. Does it last?
The source says it usually resolves, but it's definitely uncomfortable, and a sign the needle was off course.
And the really serious stuff.
Thankfully, much rarer. Skin necrosis or ulceration less than 1%, linked to shallow injection plus tension, sometimes poor aftercare.
Okay.
And the big ones, tendon rupture. Very rare, less than 0.5%, but severe, almost always caused by a significant overshoot, injecting right into or very near the tendon sheath.
A direct hit, basically.
Pretty much. And digital artery injury, also less than 0.5%. That's a lateral error. Moderate to severe consequences highlights the danger of missing sideways, especially in, say, smaller hands.
So, looking at that list, it really reinforces the point about depth errors causing the most frequent issues, like skin tears and tendon irritation.
It does. While the lateral errors causing nerve or vessel damage are serious, they seem less common statistically than problems arising from getting the depth wrong. And remember, these frequencies are based on use by skilled practitioners.
Right. Even in good hands, the manual technique has these inherent risks tied directly to the lack of precision.
Precisely. It's a blind procedure relying on feel in a very crowded anatomical neighborhood.
Which brings us, finally, to the proposed solution, DupuyFix. The document presents it as a transformative solution, doesn't it?
It does. It's positioned to fill that critical gap, the imprecision gap.
So what is it, fundamentally?
It's described as a novel system that integrates several key technologies together. We're talking robotic targeting, real-time imaging and tissue feedback, plus some AI assistance.
Okay, sounds high-tech. The goal?
The stated goal is pretty ambitious, to effectively eliminate the human error factor from the injection process.
Taking the guesswork out, basically.
That's the idea. It's envisioned as a compact, guided system. It stabilizes the hand, maps the anatomy precisely using imaging, and then delivers the drug using a smart, controlled mechanism. They see it as a potential new standard for safety and predictability.
All right, let's break down how it actually works. The source mentions 4 main modules.
Correct. First up is the hand stabilization module. Seems simple but critical.
Why stabilization?
Well, if you're trying to hit a tiny target with robotic precision, the target can't be moving right. So this module is an ergonomic rest with straps and pads to securely hold the patient's hand still. Repeatable positioning. Eliminates patient movement during the procedure.
Got it. Lock down the target. Module 2?
This is a big one. The imaging and cord localization system. This is where the seeing inside happens.
Oh, ultrasound.
Exactly. Integrated high-resolution ultrasound. It gives a real-time view of the Dupuytren's cord, its depth, its thickness, and importantly, shows the nearby tendons, nerves, and vessels.
So no more guessing based on feel. You see it on a screen.
You see it. And it gets smarter. There's AI involved to help interpret those ultrasound images. It creates a kind of 3D map overlaid on the screen, highlighting the cord, marking safe injection zones, and flagging the structures to avoid.
A visual guide map created by AI.
Yeah, and it can even help plan the injection points automatically along the cord. They also mention optional OCT optical coherence tomography for potentially even finer detail.
Okay, hand stable, target mapped, danger zones marked. What delivers the injection? Module 3.
That's the precision-guided injection arm. This is the robotic part.
Ah, the robot injector.
Yep. It holds the needle and moves along a multi-axis rail. Based on that live imaging and the AI map, the system calculates the perfect trajectory angle, depth to hit the center of the cord segments.
While avoiding the no-go zones.
Precisely. The robotic arm executes the movement, placing the needle tip exactly where planned. And it can do this rapidly for multiple injection points without needing to withdraw and re-aim manually each time.
Is there any human control?
Oh yeah, the source mentions a manual override is available for the physician.
Good to know. Okay, final module. The adaptive enzyme delivery unit. What's adaptive about it?
This controls the actual pushing of the enzyme out of the syringe. It's digitally driven, but the key is it uses force sensors.
Force sensors. To do what?
To measure the resistance of the tissue as the enzyme is being injected in real time.
So the machine can feel if it's going into the right tissue.
Sort of, yeah. It gets feedback. Is the resistance what you'd expect for injecting into a dense cord? Is it too low, suggesting leakage? Is it too high?
Hmm.
Based on this feedback, the system can dynamically adjust the injection rate and pressure.
Smarter injection pressure, not just guessing.
Exactly. It takes the variability of manual thumb pressure out of it. It also manages the enzyme dose across multiple points and includes a protocol to seal the needle track on withdrawal, trying to minimize that upward leakage towards the skin we talked about.
Wow. Okay, so if you put all 4 modules together, stabilization, imaging mapping, robotic aiming, adaptive delivery, it sounds like it's designed to counteract pretty much every single issue with the manual method.
That's absolutely the picture the authors paint. They explicitly compare it to the manual method point by point.
What are the main benefits they highlight?
Big ones are predictable, standardized results. The outcome shouldn't depend so much on who's doing the injection. They aim for near error-free injections and consequently dramatically reduce complication rates.
Which, given that complication table, would be huge for patients.
Absolutely. Plus, they mention a shorter learning curve for doctors, increased confidence, and better documentation, automated logs, images stored. You have a full record.
How does it stack up head-to-head in the comparison?
Well, manual, highly operator-dependent, DupuyFix standardized reproducible, manual high risk of leakage image placement, DupuyFix controlled, AI-guided placement.
No imaging versus real-time imaging.
Right. Manual,
Yeah.
no imaging guidance, DupuyFix real-time visualization and mapping, and manual, sort of one-size-fits-all manual pressure. DupuyFix personalized, multi-point delivery, resistance-guided, auto-calibrated. It's positioned as a complete upgrade in precision and control.
Does the document mention where this technology could go next? Any future potential?
Briefly, yes. They list some bonus features like preset protocols, uploading prior images, printable reports, even a training mode.
Practical additions. What about bigger picture?
They touch on possibilities like integrating with electronic health records, maybe using augmented reality overlays during procedures.
Overlaying the map onto the hand itself.
Potentially. And, importantly, expanding the technology. Could this kind of precision injection system be adapted for other conditions involving fibrotic tissue? They mention plantar fibromatosis that's in the foot, or maybe even treating keloid scars.
Interesting. So the core tech might have broader applications.
That seems to be the suggestion. They see it as an intelligent platform that fills a major gap in safe, reproducible treatment delivery.
Okay, so to sort of wrap up our deep dive here, the core takeaway from this document by Dr. Muhlrad and Dr. Neymotin is that manual enzyme injection for Dupuytrens, while beneficial, suffers from significant imprecision.
Yeah, the delivery method itself introduces variability and risks, primarily due to the difficulty of accurately targeting the cord by feel alone, especially regarding depth.
And DupuyFix is proposed as this integrated technological solution using stabilization, imaging, robotics, and feedback-controlled delivery to overcome those limitations.
Exactly. The goal is to make the procedure far more precise, predictable, standardized, and ultimately much safer, reducing those complications we discussed.
It really aims for a future of potentially error-free, rapid treatment for this condition.
That's the vision. Which leads to maybe a final thought for you, the listener, prompted by this material.
Go on.
Well, considering how this system breaks down the mechanics of injection air depth versus lateral, the role of feedback, and proposes such a targeted technological fix, what might this imply for other medical procedures? You know, things beyond Dupuytrens that rely heavily on manual injections or interventions based on feel and anatomical guesswork.
How could these principles, precision targeting, real-time imaging, feedback control, fundamentally change other areas of medicine where we're still relying on, essentially, skilled guesswork?
It definitely makes you think about where else technology could step in to improve precision and safety, doesn't it?
It certainly does. A fascinating look at a potential shift in treatment.
Absolutely.
Well, thank you for joining us on this deep dive into the intricacies of treating Dupuytren's contracture and the potential future offered by precision medical systems.